so much, Your Excellency Silvia Lutukuta. Thank you very much for your nice, kind words. Really, really appreciate it. You talk about the friendship between both countries. We like that a lot. Every time I go to Africa, I do feel that energy. And I'm pretty sure we'll feel that energy today. And without further ado, I will call here on stage, starting with Marie-Ange Sarakayau. So the Managing Director, Resources Mobilization, Private Sector Partnerships, and Innovation Finance, Gavi. A round of applause, please. Followed by Beatriz Imperatori. So it's our Executive Director of UNICEF Portugal. And we have as well Ricardo Batista Leite, the CEO of HIDER and President of UNITE, Parliamentaries Network for Global Health. A round of applause, please. And we will be joined online by Rhoda Van Enze. She is Professor and Dean of School of Public Health. She will be joining us, hopefully, very soon. And we have been having here a very, very interesting discussion so far. And I have here a couple of questions, and maybe I will throw the first one to Marie-Ange. So, Gavi, the Vaccine Alliance, has been at the forefront of global efforts to increase immunization rates and improve health outcomes. Question is, Marie-Ange, so how can partnerships between Gavi, Europe, and Africa contribute to achieving the shared vision of equitable and resilient health systems, and what role does, very important, sustainable financing play in this context?
Thank you so much, and it's such a pleasure to be back here and to see so many friends. Really, I think the first thing really to start with, Daniel, is that it's all about the alliance, being part of an alliance, an ecosystem, and we heard quite about it today, especially this morning and in the various sessions, and also, the Minister from Angola mentioned. So it's really, when you think about Gavi, it's already, showcasing actually the power of the alliance between Gavi, the countries we work with, Angola, Ghana, and many more, Team Europe, because we like to call it Team Europe, because it's about partnership all together. Our alliance partners, WHO, UNICEF, the World Bank, the research organization, the production capabilities of vaccine manufacturers, the great energy and mobilization of civil society, and of course, the funding that we get from various investors. And what's really great here about this alliance is that it's really at the forefront of creating a fertile ground for innovation. And I think that's what actually we can do more of. Of course, I should say that we are already partnering. You heard this morning our president talk about, having as partners all together, Gavi, Africa, Team Europe, delivered more than 1 billion, vaccinated more than 1 billion children, of which roughly half are in Africa. So it's how we do so much more, and I think the minister talked about it. And I think there, when we think about health system, we do need to think a little bit about the value chain. It's not just a system, a vague system. It's about the research, it's about the manufacturing, it's about having the perfect logistics, having the digital tools that allow the surveillance, the registry of the children, the cold chain. And all this actually is really fundamental. And I think what we see here is that the innovation can help us from both sides, in the Team Europe, Africa, can really help us go forward. So I think here, I will call actually, I know that we have, of course, a lot of governments in the room, but also a lot of investors and private sectors. And I want to put them on the spot here, because I think what's needed really is not just governments, and we heard our colleague earlier on the European Commission or African Union, is really bringing the cutting-edge technology and partnering. And when this happened, it's fantastic. And I will give an example, actually, of a drone company that we partners with, Gavi, Ghana, the UPS Foundation, and Zipline, that company. And through that partnership, actually, we are now able to deliver wherever you want in Ghana, through 4,000 facilities, vaccine in 25 minutes. And it had never been done before. And guess what? I laughed when I heard earlier the Minister of Education of Ghana talked about transferring, technologies from the US to Ghana, because actually here, it was done in Africa. It started in Rwanda, put at full scale in Ghana, and guess what? Now it's reverse technology, and now it's being done in the US, learning from that experience. So Anita, this is Africa Rising. But you talked about sustainable financing, and there I will quote Antonio, because sustainable financing he talked about a marathon earlier, is the food that allows you to continue running, right? And to continue running, to having the right product at the right time, the latest product, and of course, affordable. And here it's really about the balancing act. It's really pulling the demand of all the countries we work with. And we heard we have 54 countries representing 1.4 billion people and going to 2.5 billion. Mm-hmm. And basically using, the strengths of capital markets. And this, I have to say, Team Europe has been fantastic, because we have developed incredible products in innovative instruments like vaccine bonds to basically have long-term financing, so that you can continue financing at affordable prices the research and development, the vaccine manufacturing, and put it all together. So that's why it's so important. And I would conclude by saying it's really a partnership because the African countries themselves contribute. And actually in Gavi, it's 50-50. They contribute 50%. So, from all the years we have been, they have themselves put in their parliament, in their budget, the resources needed. So that's why it's really this true partnership. But to continue going on, we do need the private sector, and I want to talk to a few of you later. Thank you.
So the invitation is out there. And I love the part of Europe as well, learning from Africa. And not only Europe, you talk about value chain, the Team Europe. Let's maybe come here to Portugal, and maybe Beatriz, to you. As the Executive Director of UNICEF Portugal, what specific strategies or initiatives has UNICEF implemented to strengthen health systems in Africa, particularly in relation to manufacturing and access to vaccines, medicines, and health technologies?
That's a really short question. Danielle, if I may, it's been a long day, and we try not to repeat ourselves, and it tries still to be of some relevance to everyone. But at lunchtime, someone asked me, "But are you UNICEF? And what are you doing here?" I thought, "Oh, there's a little bit of explaining perhaps to do." And I thought it's good when people, start with a obvious question and you don't immediately jump to the answer. But there's this, and perhaps I will start with some numbers of UNICEF. We did in last year, 2022, about $7.3 billion of procurement for goods and services. Almost half of that was for vaccines and biologicals related. And then we think, oh, this is a really huge number. We are on pace, right? Wrong. So it's not enough what we are doing. And although we have partnerships, fantastic partnerships, we have more finance. We still have a third of the global children's deaths happening in West and Central Africa. So this is a bit about urgency. And we also talked during this day, we want action. We want to make it happen. We want real things to happen, but not just at our level, because we are decision makers. We are probably business people, but we need to make a difference to people, to children, to communities. And that is where we have to make our effort you know, and this is an urgent message that we need to convey to everyone that is here. And so this is why we are so worried. Although we did have today some good news about vaccination, you probably saw the report, the WHO and UNICEF's report saying that we have 4 more million children vaccinated since last year, but we're still under pre-COVID numbers. And so, yes, we do need to work urgently, and we do need to make it happen. And so, partnerships is one way. And partnerships can be monetary, funding, money, but they can also be different. And so when we partner with a business, we're looking for capacity building, training, and we looking for sustainable partnerships, because it's not good enough to have a one-year partnership. We need to look into this in a sustainable way, because we want change to be there and to stay there, where the communities are and where the companies, the local African companies are. And so UNICEF is trying to evolve in this model of partnerships, trying now to partner with local companies, because that will bring us more effectiveness, because a local company that manufactures in the country near the community is, of course, going to be cheaper in delivering, going to be cheaper for supply chain, but also is going to have a multiplier effect on the whole community, on the local economy. And that is why it's so, so important to foster local production. And how can we partner with those companies? So we can start doing marketing intelligence, demand shaping, which is about really understanding what is needed and how is needed, and when has it to be available and how has it to be available. And we've talked about supply chain, and when we talk about vaccines, we talk about cold chain, and cold chain is an issue. And so either positive cold chain or negative, it is an issue. So we do need to strengthen, but we also need, and it's possible to do so, to use those chains that already exist from partners and collaborate in order to make access more easy and really have this last mile for vaccines enhanced. I would say innovation also has a strong part to play on this, not just what you talked about manufacturing, but also, and we talked through today, digital transformation is there and we need it. We need digital transformation to collect better data, quality data and timing data. So there's a huge space for innovative solutions. We talked about drones are a good example as well for the last mile. So there are now good examples of using drones to really deliver vaccines to local communities in a safe and quality, preserving the quality of in this case, vaccines. And the last, I would say, 2 more dimensions or strategies that we need to put in place. So it is the strengthening of primary health care, but community-based primary health care, where women have a very important role to play. And so, once again, capacity building for communities in the health dimension so that they can deliver themselves to their own communities, empowering the community and having those health services available at the local level, so primary health care. And one last dimension, extremely important nowadays, which is build trust for vaccines. And this is also community-based work, and it's also a dimension that we need not forget, because we need to regain the trust on vaccines. And this is a work that needs to be done locally, by the communities, of course, with experts, but we all need to be engaged on the local level. Thank you.
Excellent, Beatrice. And you talk about several times about urgency. And what came to mind was COVID-19. So maybe, Ricardo, this one to you. The COVID-19 pandemic has exposed the vulnerabilities of health systems worldwide, so across the world. As a leader in the field, what strategies political leaders should pursue for Europe and Africa to enhance their joint response to present the future and the present and the future health challenges, taking into account the need for preparedness and agility?
Thank you, Danielle, and it's a real pleasure to be with all of you on this panel, and it's a great honor to be here at this forum. And 3 generations before me were born in Angola. I was born in Canada and have worked in many countries around the world. And everywhere I go, the Portuguese diaspora is the most passionate I can find regarding Portugal. The Portuguese National Day is never lived the same way as we live it when we're abroad. And so I want to use this moment also to congratulate the Diaspora Council for their amazing work and leadership in the field. And I think it's important that we continue to let the Portuguese descendants know that they are loved by their home country and that they are welcome back, and we need to work towards that. That being said, the EurAfrican Summit is extremely important because I'm reading a really interesting book right now that just came out called Pathogenesis that talks about the origins of all of living things. And at the end of the day, you understand that it all started in Africa. And it becomes very clear that that's where the heart and soul of Homo sapiens is, actually. And that's why when we heard about the African music, it's no wonder that all the fun is happening in Africa, and then it just dilutes as it moves around to the rest of the world. And we need to understand, it just goes to show how stupid racism is and how it is fueled by ignorance and lack of understanding of our history as humans. But that being said, that was a side remark. Going to your question, Danielle, I would say that from a political perspective and a global governance perspective, we have seen a major transformation in what we understand as being globalization following the pandemic. The idea of the world having a one-stop shop for different products and services is dead. The idea that we will depend on China to produce all of the masks when we have a respiratory pandemic in the future is dead. To understand that we need to respect regional sovereignty is something that every political leader needs to understand today. This is not a request, this is a demand. And particularly in low and middle income countries, particularly in sub-Saharan Africa, we understand that there's a voice that is coming down from the roots, from the grassroots of nations, saying no more. We will not accept digital colonization or any form of imposition from the global north again. We saw how South Africa was punished for having invested in genomic sequencing, because every time a new variant of COVID-19 was discovered, it was called the South African variant, and most of countries of the world, with no scientific evidence to back it, would block any flights coming out of South Africa when they were basically identifying variants that many other countries were unable to do because had no technological capacity to do so. And so that leads us then to a change, a new world order, if you will, when it comes to globalization, in which we are moving towards regional sovereignty and regional interdependence, which means that we will need to foster local capacity in terms of development and production, which means there's going to be a rise of costs. But that's the costs of doing globalization today, and we need to embed that within our business models, be it in the development world, be it in the governmental world, be it in the private sector, which is critical for us to reach the Sustainable Development Goals by 2030. We are lagging behind. The pandemic pushed us even further behind, and if we do not bring in the private sector money, it'll be impossible for low and middle income countries to reach the marks that they need. That leads us then to how do we avoid the future pandemics. And today, the WHO is leading the negotiation of the Pandemic Accord, which was launched by member states at the World Health Assembly last year. And hearings are going on right now. If everything goes well, it will be approved in the World Health Assembly in May 2024. next year. But then it needs to be ratified at the parliamentary level. And the Unite Parliamentarians Network for Global Health, which I lead, we're present in more than 100 countries around the world. We organized a session at the World Bank Spring Meetings last April in Washington, and I asked a panel, and I asked a room full of parliamentarians, more than 300 MPs were in that room, and I asked them to raise their hand if they were knowledgeable about the pandemic accord negotiations happening on behalf of their governments in their countries. Not one hand went up. Parliamentarians have no idea what is happening. And these are the people that we are counting on to then approve the pandemic accord, to ratify it at the parliamentary level. And why is the pandemic accord so important? Because it will define the rules that we're missing when the pandemic hit in 2020 with the COVID-19. We had to learn flying after we jumped off the cliff. And one could say, no, we've learned our lessons, never again. What happened in 1918 with the Spanish flu, we saw many of the mistakes repeated 100 years later. And we saw the World Economic Forum risks report that is done by business leaders and political leaders that put health and pandemic preparedness at the bottom of the list of all concerns in January 2023. So at that point, we were still in pandemic mode, and nobody cared about the pandemic anymore. We need to make sure that the inter-country, cross-border threats regulations are put in place so that we do not repeat the mistakes that we've made in the past. And with the rise of travel, with the rise of globalization, in this new world order that I mentioned, we will have more pandemics. It's not a question of if, it's a question of when. And that being said, the last point regards to then preparing our health systems. And looking into that future, it doesn't look good. Right now, we are hearing a lot of people asking for universal health coverage. We all defend that. But what does that mean? And what we are seeing happening today is richer countries of the world, like the European countries, trying to export our broken disease-driven models into low and middle-income countries. And what have our health models led to? Portugal is no exception. A rise of burden of disease and a rise of cost to a point of unsustainability that is creating a two-tiered system, one for those that can pay and one for those that cannot. That leads to poor health, which leads to a rise of inequities, which leads to a world where well-being is not present. And so we need to use this opportunity. Technology can play a tremendous role, and in my new role at the International Digital Health and Artificial Intelligence Collaborative, we're working on how AI can play this role so that low and middle income countries can leapfrog. As we heard the minister from Ghana say, we can leapfrog from many of those mistakes the richer countries of the world have made towards a future in which systems do not follow disease, do not react to disease, do not just build more hospitals, but actually build systems that foster well-being of the people, focusing on prevention of disease, focusing on promotion of health. That future is possible. It is possible to embed that vision within the pandemic accord, and that needs to be part of this new world order that could keep our citizens safe and healthier in the future. Thank you.
Thank you, Ricardo. And so far, Marianne, Beatriz, and Ricardo, we talk a lot about urgency. Now let's maybe go virtual to Rhoda, that is joining us from Uganda. And we talk a lot about future pandemic, infectious diseases. So maybe, Rhoda, a question to you goes in the following lines. With your extensive experience in infectious diseases, research and program management, how can the collaboration between Europe and Africa strengthen health systems to effectively respond to present and future health challenges, in particular in areas like HIV, tuberculosis, and maternal and child health?
Thank you, Daniel. I appreciate the opportunity to join you in this forum from Kampala in Uganda. and to share my perspectives. But perhaps before I get to how the collaborations can help, I need to contribute to the issue of the urgency that Beatrice so ably demonstrated. And to say that in Africa we have quite a number of challenges that have persisted, especially a very high burden of infectious diseases, that is TB, HIV, and malaria. But we also still have neglected tropical diseases. And every time I use that word neglected, it makes me feel really uncomfortable because it's neglected by who? And what can we do about this, even as we think about some of the other emerging and re-emerging diseases? We still have a very high prevalence of some of these neglected tropical diseases, like schistosomiasis or bilharzia, as we may, where in some countries, like my own countries, as high as 29% when we last did a survey about 2-3 years ago. So we still have all these issues, but at the same time, we have a very rapidly growing burden of non-communicable diseases. And then the continent reports so many disease outbreaks, as high as 100 in a year. And this puts our populations at very high risk in terms of health, but it also holds us back in terms of development. And these are not restricted only to the continent, as we know it from COVID. So there is need for us to work together to be able to address these issues. And we see a lot of opportunity in the emerging health strategies. The EU Global Health Strategy right now emphasizing health security in the agenda and health for all. So hopefully this might be a contributor to universal health coverage through the entire spectrum of health promotion, primary prevention, as well as clinical care and rehabilitation, and not just focusing on the curative services as we've been doing. So there is a lot of opportunity there. And we also at the same time have the African Union Public Health Order, the new public health order that's now emphasizing addressing structural issues in public health and making sure that we have a more efficient preparedness and response mechanisms. Then one of the other things I thought I should also mention is that this collaboration, again, has a lot of mutual benefits for both Africa and Europe. And there's lots of potential, there's lots of experience to build on. And we also have a growing, really eager to learn and innovative young population that's contributing a lot of, innovations that can add value not only for Africa, but for the rest of the world. So I see this collaboration building on a lot of experience that we have on the continent to enhance research and development, systems for health, and also service delivery across sectors that are critical for health. And I really do hope that we can also at some point rethink health systems, as we traditionally call it, because we know that health is delivered mainly out of sectors outside the health sector. So these are some of the issues that I hope we can learn from and build on. And I'll just emphasize perhaps 2-3 issues in terms of the gaps that we perhaps need to carefully think through as we think about joint efforts to address some of these issues and be more prepared. Some of these are issues around the multi-sectoral leadership and governance for health that goes beyond the health sector, issues around service delivery, not only for health, but also protection, including social protection for populations during disease response mechanisms, data and information systems that can help us accurately plan for and track improvements in health, as well as issues around workforce in a broad sense for research and development, as well as service delivery, technology and medical countermeasures. There are a lot of issues here, diagnostics, therapeutics, as well as vaccines. And then thinking around issues of sustaining supply chains for essential equipment, as well as commodities that we need for health. So there are quite a number of issues in this, but also looking at the entire value chain, the research and development, especially basic science and clinical research, requires a lot of infrastructure in laboratories, IT infrastructure. We've been talking about innovations such as drones, and some of our young people might be able to add value in developing some of these technologies, which they're already trying to do, even with the limited capacity. So we need to be able to invest in this, right from the upstream to the downstream systems for delivery of this. We also have issues around transfer of technology. I guess we can say it's exchange of technology, but there are areas where we have to admit that there's going to be a transfer for some of these, and capabilities, especially in terms of highly skilled individuals that can be able to add value across the value chain. But I also need to note that when we talk about these within research and development, within academic institutions, as well as research institutions, we need to note that when this is embedded within the health system, it's not just for research, but it's actually reserve capacity for service delivery and response to outbreaks when we have challenges. And we saw a lot of this happening at the time when we had the COVID pandemic at the height of it, and where systems were overstretched and the backup support was coming from academic and research institutions to support systems for testing as well as systems for surveillance, as Ricardo noted, for example, detection of emerging variants of disease. And this is so important when we have this well developed, not only for research institutions, but also to support the service delivery and surveillance systems. This is so important for us, for Africa, but also in terms of protecting the broader global ecosystem. So I would say that, in summary, the partnerships between EU and Africa offer mutual benefits, not only in terms of the potential to address challenges posed by disease, but also in how to leverage technologies, the markets, innovations, expertise, and resources for sustainable development. And I like the reverse technology. We need to be talking about that more, but research, reverse innovation and learning in many ways. There is an opportunity and a lot of experiences in Africa that we can share with the rest of the world. Thank you.
Definitely, Rod. I really appreciate it. And you talk a lot about issues, and one of the things that comes to my mind is intellectual property. So maybe Marianne, this one to you. The intellectual property rights have been a contentious issue when it comes to access to medicines and vaccines. How can we navigate the balance between protecting intellectual property rights for innovation in fostering technology transfer, we talk a lot about, to enhance local manufacturing capabilities, in particular in LMIC's low and mid-income countries?
No, thank you, Daniel, for this. Indeed, it's really a delicate balancing act. But I think first, what has to be said is that, it is imperative that everything is done to accelerate the access to vaccine and to other, medical treatments. And of course, for this to put in place all the mechanisms and policies, including Parliament, so that these things can happen. Now, the main thing here is that there is an implementation time lag. And so when we talk about urgency, there are things that need to happen immediately, and they don't necessarily involve the IP. Because it's more about transfer of technology that can happen quickly. Because IP, indeed, because it's contentious, takes a lot of time to be discussed. And in a sense, you have to balance having access quickly and then probably going through transfer of technologies on various routes. And of course, continuing the important advocacy and work to discuss the IP and finding the right balance between the innovation and continuing to incentivize that R&D and innovation, but also allowing new entrants. So I think that, particularly on vaccine, I think it's also important to recognize that in vaccines, the IP may be less of an immediate issue than other drugs, like we have seen for HIV/AIDS, for example, because it's really this unique expertise in making the vaccine actually that is lacking. And I think that's what's important. You know, I always say, and you know, I was trying to buy last night a book from a famous Portuguese chef. And I can have the book. It's like the IP, right? It doesn't mean that I can do the fantastic recipe over and over and over. And that's a little bit the issue here. You do need the chef to be with you, and that's where education, we talked about it earlier, quality education. So when it comes about allowing new entrants, what's important here, and I think the minister alluded to it, and some of the colleagues, is having the ecosystem. You need to have a trained workforce because you do need the engineers. These are, especially vaccine, very high barriers to entry in terms of sectors, because it's, after all, a living body and people are healthy when you put it. So you do need to have these trained engineers. You do need to have the great regulatory framework, very important, because then it goes back to trust. You know, if you are not sure that you have the best regulator, then the issue of trust comes into play. And then, of course, you do need the technology transfer and the investments. So just to put it all in context, that there are relative balances there that are important and that we all have to work within it. You know, and I do like the fact that our colleague earlier talked really about the importance of regions, because these are such important endeavors that indeed you do need to look at it on a region-wide, especially for vaccine investment, because they are huge, and in a sense, to make it effective, you do need to spread it over a larger population, and that's where the importance of EU partnership is so crucial.
Beautiful. Thank you so much, Marie-Ange. And you were just talking now about regions, and we go back to the collaboration between Europe and Africa. And maybe to you, Beatrice, here one question. We know that the collaboration between Europe and Africa in strengthening health systems is crucial to achieve global health equity. In your opinion, what are the key challenges that need to be addressed to ensure equitable access to life-saving vaccines? We were talking about medicines and health technologies for all populations, regardless of their geography.
I always get the small questions. Perhaps we could bring in a different dimension that I think we haven't touched upon, and that is we cannot talk about health separately from education, or separately from water and sanitation, or separately from protection. And so when we address these issues, you need to understand that we are always in a frame of a multidimensional factors, situations, and contexts. And so this is to say that, okay, we can be best in class for vaccine design, but it's not going to make it. And so we need to understand that in order to tackle any of these dimensions, we need to take them together. And that is really about, when you look on the SDGs, they look separate, but at the end you have that says partnerships. If I'm not wrong, it's 17? 17, right? So 17 says partnerships. And it is this idea that you cannot do it alone, nor with a single vision. So you need to combine. We are dealing with complex, multiple factors, and we need to address those. And so when you say challenges, this is a big challenge, because we cannot make it on our own. It's not just about the health, it's not just about the education, it's not just about the water. It's about all of them. And we need to, there's a baseline where we need to make them all work. So I would like to bring that into the conversation. Then when you talk about challenges in Africa, we need to talk about population. The population is still growing. And so if you think about what we have lost during COVID, and in vaccines, if you want to get to the same rate, you have to double your effort, because you are not talking about the same population. It has grown. And so your effort is bigger. It needs to double. You need more investment, but we've talked about that. We need also to look into economic barriers between countries. Some African countries are landlocked, and that can be a huge disadvantage as well if you don't have transport infrastructures. Can be. It's not necessarily, but it might. So, but you need to look into all those factors. I would say that the big challenge is really to accelerate what we want to address and the way we do change. And that is a huge effort for every one of us in this room, you know, decision makers, institutions, businesses, people. And it's really, I think it is the big challenge of them all, is really just don't stay here talking and really making it happen. Because we have money, and we know that, you know, our economies, big economies, do generate money, do generate resources. So it's about the decision where to deploy those resources. And resources is not just about money, but it's about brains, it's about, you know, what is out there. How are we going to use those? And that is a challenge by itself, and it's something that we cannot forget. And yes, my message here is to take action as well.
Marie, you want to add something?
Yes, I would have said, you know, rather than challenge, it is an opportunity. Huh? It is an opportunity because, as we have heard throughout the days, there are various different tools that can help leapfrog. There are connections, and that's why we are here. It's about connecting and understanding where the opportunities are. It's about signaling the demand and investments, and that's why these forums are important. So I do think that I want to go back to the title of the conference. I think these are tremendous, I'm an optimist, but these are tremendous opportunities, and, you know, and so many more that can come. So.
Yeah, I totally agree. You know, I don't want to be pessimistic. I just want to lay it out, because I think, as you do, that they are really opportunities, two-way opportunities, and we need to address those and take those in a very positive sense just to make it happen. So thank you for your point as well. I just wanted to make a final remark on challenges, and we've talked about briefly, and is climate change. And so climate change will make some of the issues we have been talking about much more intense. And when we talk about poverty, and we talked about the Sahel, and the extremely dire situation that the Sahel is going through right now. Mm-hmm. So when we talk about droughts, you know, you talk about poverty, you talk about a girl that spends 8 hours to get water and not being able to go to school, but his brother is going to school, but she's not. Mm-hmm. It's expected to be so. And so climate change will have a profound effect as well on those communities, on the ability, the access to quality education, even to education, to health services, to immunization. And it will put an enormous strain on the already existing services for the local communities. And so also a big challenge for us, and an opportunity, is climate change.
And we talk about challenges and opportunities, and immediately what was coming to my mind was artificial intelligence. Challenge, opportunity, what is that all about? And maybe, Ricardo, I give this to you. So, drawing on your experience in politics, what policy measures do you believe are necessary to foster effective collaboration and joint efforts between Europe and Africa in manufacturing and accessing essential health products? And how can political leaders drive these initiatives forward now with the angle of artificial intelligence?
Okay, so let's try to fix the world problems now with AI. But just before that, picking up on what was just said, it's very important that everyone understands that the main cause of disease everywhere in the world is one single factor, and it's called poverty. Poverty is the main driver of disease anywhere in the world, and it's not just poor countries versus rich countries. If I get on the train here, across the street, and I go 15 minutes down, I will see a decrease in life expectancy within the same city. And this is the same phenomena everywhere in the world. So ministers of health, prime ministers, presidents, their main role when it comes to health is not just building more hospitals. It's actually focusing on lowering inequalities. And as was said, fixing health needs to address all 17 Sustainable Development Goals. So one can ask, what is the role then of technology there? Well, it can be tremendous. When it comes to basic health technology assessment and access to medicines and vaccines and so forth, we now see a rise in Africa of hope with the emergence of the African Medicines Agency, which not only can potentially learn from a technical point of view from the European Medicines Agency based in the Netherlands, but actually use this opportunity to leapfrog. My organization in Geneva is working with WHO to validate AI-driven tools towards making sure that these tools keep citizens safe and are delivering what they are promising to do. Right now, we are living the Wild West of AI, where everybody's doing anything they want. It's like when the new car, the mass production of cars came out with Henry Ford. You know, beginning of 20th century, cars were made available to an important part of the population. It took us almost 60 years to develop the three-point seatbelt so that people stopped dying of car crashes. And it was only made available, and this goes to your IP question, because the engineer responsible for creating the three-point seatbelt, what we put on every day, I hope, at least some cars remind us that we should, was only made universal because Volvo, where the engineer worked, made that patent accessible to the rest of the world. Which makes us think, particularly when we talk about health technologies, we have to have a very serious discussion about patents. And that's another important aspect that I think, going back to the pandemic, we should have learned from. Because we created COVAX and the ACT Accelerator and all of these mechanisms to accelerate access to vaccines. But now we have, a lot of discussions around IP and how do we make sure that technologies that can save lives are deployed and made accessible where they're needed immediately, without those kind of discussions. And if you go back 30 years to my original field of infectious diseases, you see what happened with HIV. It took us 15 years to make sure that antiretrovirals were made accessible to the continent where, even today, most people are dying of AIDS, which is Africa. And so we need to learn from all of these lessons moving forward, and these are all policy issues. But looking at the power of technology, we can see that using artificial intelligence can help precisely do what I was saying before, which is helping governments leapfrog into the future, using these technologies not only to deliver healthcare more efficiently, but also identify where there is greatest need, use predictive technologies to identify those needs, and actually to obtain the information that is needed for management of health systems without having to extract people's data. We spent the last 20 years saying, give away your data, collect data. Actually, with AI, we can go into data sets and take out the information we need, solve the interoperability problems of technology, and go in the direction of fueling our data-driven systems without needing that data directly, which keeps data sovereignty intact while doing exactly what we need, which is obtaining the information to help drive solutions. Which leads us then, how do you fund it? The financial aspect is critical. And that's where the World Bank, development banks can step in along with the private sector. And I think the Global Fund for HIV, AIDS, TB, and malaria has a very interesting scheme where funding from member states that is given to the Global Fund, aligned with domestic funding, is matched towards investment in the country and focusing on concrete outcomes. And I truly believe that that's what SDG 17 around partnerships is about. It's not just getting money from the global north and pouring it into the global south, but it's creating a partnership. And that leads us to another issue, which is, and we have a lot of representatives from African countries here, a country that passes the threshold from being a low to a middle income country, that's a curse. Because then they stop having access to funding of the World Bank and many other development institutions. So understanding that we need a step-by-step process, that we don't have a straight threshold that cuts countries off, but understands that we need to evolve together in partnership, I think, is a critical aspect. That being said, I believe that AI can help us not only foster better solutions in terms of health and well-being of the population, but also ensuring access to parts of the world that are difficult to reach. But that leads us to another big issue, which is the digital divide that was mentioned also here today. And yes, COVID has led to many more people having access to phones, but the recent study showed, done in 33 sub-Saharan African countries, shown that out of the 100% population, 20% didn't have a phone and never accessed the internet mobily. Out of the other 80%, 40% had a basic phone, and of those, 15% had access to the internet once. And the rest of them, the rest of the 40% had a smartphone, and of those, around 80% had access to the internet. So about 50% of sub-Saharan African population does not have access to the internet and a smartphone. But worse than that, another study showed that the further away we are from a hospital or clinic, the lower the probability that that person actually has access to the internet. So we many times say technology is going to solve the problems precisely for the remote populations, for those that are further away, but those are the ones that actually are suffering the most from the digital divide. So artificial intelligence used responsibly can actually help us with many of the problems and challenges we are facing, but to do that we need to make sure that we solve this digital divide together, and that's why our private sector and public sector have to come together. And if you think about it, it's not hard, because if you think of Apple, or if you think of any of the big phone producers, the youngest population in the world is in Southeast Asia and Africa. This is their future market. Give them the phones for free today. An Apple user today will probably stay an Apple user for the next 10 years. And they will rise out of poverty and make sure that they continue to be good customers. It's a win-win for $3 trillion owned business. And so I really believe if we can collect that energy and effort, not only can we do a service to the world, getting people access to the technology they need, and which hopefully can lead to the outcome, focusing on the outcome, which is making them healthier, focusing on the well-being of people, and ending the divide, be it digital or any, towards the equity and well-being of all. Thank you.
Thank you. And as we keep this round of applause, we are running out of time. So I want to thank very much Marie-Ange, Beatriz, Ricardo, and Rhoda. Thank you very much for joining us. And ladies and gentlemen, I hope that you enjoyed this discussion on strengthening health systems, manufacturing, and access to vaccines, medicines, and health technologies. Let's take action. And please join us as we pave the way forward into a healthier and more equitable world. Thank you very much, all of you.